Hi, my name is Jung with MBhealth Insurance Agency, and I'm here today to talk a little bit about understanding the benefits of a health savings account. So a lot of people ask me, what is a health savings account, Dan? Do I lose it? If I don't use it by the end of the year, how does it cover my costs? How does it actually benefit me? And so there's a lot of different things that I could talk about, but we'll just do something kind of briefly and hit on some of the main things that I think are really important when I'm talking to somebody about the benefit. So in a health savings account, a lot of people just say an HSA, and so what does that do for somebody in terms of the healthcare costs? And how does it compare to a conventional plan that you hear people talk about? So a current plan that I write for somebody, you're used to a deductible, you're used to a coinsurance, but before any of those things kick in, you might have your office visit copay for your primary care or your specialist when you see somebody there. You also may have pharmacy copays. Well, an HSA pretty much is real simple for me to explain to folks. Until you meet your high deductible, you don't get any of those copays. You've got to satisfy that before those kick in. Some plans have them after you meet the deductible, some don't have them at all, because you might meet the deductible in the same time you might meet the out-of-pocket maximum. So those are the things I kind of talk through. And a lot of people say, well, that doesn't sound like it's giving me anything more beneficial than my current plan. Well, what I would say to you is the other layer of a health savings account is the tax benefit that you're going to get from it. Okay. So anytime that I have a sick visit or a prescription or many other things that can be used as qualified medical expenses that might not even fall underneath what your medical plan is. And if you're really looking for a document that you only want to read sitting down because it could put you to sleep, would be the IRS publication 502. Just talks about a lot of things, dental expenses, different things I can use money that I will get a tax benefit from. Okay. So that means if I go to the doctor's visit and it's $200, well, the discount for having health care might bring it down to, let's say $100. Then I pay that from my HSA, and then that money is going to be money that I'm going to be able to deduct off my taxes if I don't have it taken out of my check at work. So it's a pre-tax or a post-tax opportunity to pay for medical expenses with tax-free money. How much can I put in yearly? For an individual in 2023, I can put up to $3,850. For a family, $7,750. If I'm age 55 or older, an extra $1,000 can be added to those numbers. And so me, a family of four, I'm on an HSA, I have up to $7,750 a year that I get to deduct off my taxes. Now that is just a small caveat of what an HSA can do for somebody, and we could talk about many other things and how does it work, when should I use it, and that's what we here at MBhealth Insurance Agency love to do, whether that be on an individual plan or a group basis. I appreciate you taking the time to listen to me, and if you have any questions, please reach out to us at 314-544-5400 or find us on our website at mbhealth.com.